Well, certainly Kevin has been just an outstanding leader for many years in the whole area of diversity and of bringing along the next generation of leaders from our minority communities and keeping that issue front and center for the AHA all the time. I also think of Kevin and his longevity. He's been in a leadership role for a long time, starting out as a pretty young man and rising through the ranks. And I think the final thing is that 2007, he was my first board chair. And it was as we were rolling up to the debate on healthcare reform and the Affordable Care Act and so on. And Kevin really took a lead role in laying down the foundation, the building blocks for our Health for Life framework that really guided us exceptionally well in that whole debate.
There's so many things. You can actually start with the Affordable Care Act as a cornerstone, but beyond that, I think under Rich's leadership, the AHA broadened the perspective. I think our members across the country look for AHA from an advocacy, public policy, governmental affairs relationship, get the money in DC. Under Rich's leadership, we've really broadened the focus for other areas that the field needed, everything from quality to diversity to governance across the board. So I think that's a legacy that the AHA broadened the perspective in terms of needing to take a leadership role for what our nation's hospitals needed at the time. Above everything else, on a personal level, Rich brought a transition, having been a health system CEO, so he had instant credibility with the field coming into that role. And then the fact is that under his leadership, we've really expanded into a lot of areas. And under Rich's leadership, the main thing he brought was leadership and a feeling of integrity that if Rich said it, we could take that to the bank.
Well, I don't know about Kevin, but I try not to think about the complexity. And I certainly try not to think about the size or the diversity. You try to think about the issues first. And for us as an association and as a field, it's easy in the sense that we know who we're all about, and it's all about the patient and collectively about communities and doing the right thing. A friend told me a long time ago, if you want to know what to do for a patient, if you want to know what quality is, just get between the sheets and look up. And it becomes a lot more clear. So you deal with the issues and the right thing to do first, and then you work it through whatever structure you have, whatever bases you have to touch. And you obviously then start to feel out what the points of friction and the points of agreement are. And you work to build up the latter and minimize the former, but you keep focused on the right thing to do. And most of the time, everybody sees what needs to happen, even if it's a bit uncomfortable.
And again, you always start with the mission, and for us operating in a faith-based organization like Catholic Health Initiatives, we feel that the Affordable Care Act and where healthcare is going has really put us in a position to do what we should have been doing all along, looking at focusing on improving the health of communities. And that was a founding tenet for us. So the main thing is really the stick-to-itness, the ability to get people to see on the horizon. The way we approached it was we envisioned out to the year 2020 and said, let's work our way back. And then from there, you always didn't hold people to here's the vision where we're going, and people buy into that. So it's very difficult, challenging for people to change the mindset. But I think at this point in time, the train's going down the tracks and you know where we're all heading. So it's actually, it's very challenging, but it's also a lot of fun. To get people to move out of different paradigms and to really look at what we need to be doing in healthcare in the United States.
I think one thing that has really helped us move is the whole issue of transparency.
Right.
I mean, that's what's different these days. So much is out in the public that you have to be doing the right thing, or you're going to have a whole bunch of people calling you on it. It spurs everybody forward.
The basic principle is to be true to yourself. Everyone has to look at themselves and begin to see what direct impact that they're going to have. But in terms of the skills, I think it's a lot more flexibility. The transparency that Rich spoke about is also very important. Being able to know that it's not like leading a team, but being a part of a team, knowing that we have to coalesce a lot better with physicians in order to be able to get the work done. So it's really looking at things from an executive point of view, that we're in this together, and looking at ways that we have to work together, give and take, not just inside your organization, but with the communities that we serve, with people down the street that have been competitors in the past. We have to come together and really coalesce and realize that we have to work together with our communities and others to make sure that we can accomplish our objectives.
Yeah, I think a derivative of what Kevin just touched on is collaboration. That's not been the mode across healthcare for a long time. So going from the competitive mode to the partnering collaborative mode is certainly essential. I also think that going into more of an entrepreneurial mode, which we haven't had in a kind of a volume-based enterprise, that's going to be enormously important. And people who are entrepreneurs focus like laser beams on cost, on the customer, on service, and frankly on changing an organization even before it becomes obvious that it must change, because you have to constantly stay ahead. So I think there'll be a whole different culture in the market in that sense for the next generation.
And speaking of that culture, again, one of the things that the younger generation can help us with is the social media, just the different aspects and the way that the world is looked at, and the fact of how you reach people. So we're having to make adjustments in terms of how do you actually attract millennials to come into the workforce in your organization. So they bring a different perspective. They have different values than people our generation did. And so the blending of that and incorporating them. And so we just say, speak up, make sure that that your voice is being heard, and that there is a lot that you can contribute to the organization even at an early career level.
That's right. We're certainly looking forward to a positive and supportive ruling. We believe that's absolutely what the situation requires. On the possibility that that doesn't happen, we're also working very closely with the states to figure out what are some possible actions. But you can only go so far because you don't know what the court is actually going to direct to be done. You don't know what the administration will allow by way of any latitude or flexibility in that regard, or can allow. You don't know if Congress is going to come together and do something to correct a bad decision, bad from our point of view. So there's only so much you can do. In that case, you go back to the leadership issue. You stay positive, you help people understand what the context is, you talk it up among others, but you prepare for the worst.
And again, we lean on Rich and the leadership at AHA and our colleagues at the Catholic Health Association to help us with the detail. I think from an operational perspective, CHI operates in 18 states now. We're roughly about half and half in terms of which states expanded Medicaid. So we're kind of a microcosm of how healthcare operates in the country. So we just learned it's going to be different in every state regardless. And so we're in some states that haven't expanded. So our view is that regardless of what the ruling comes out with, we're going to continue going down this path. We're going to continue to have to move towards improving the health of communities, and then there'll be various ways that we do it, and then we'll just have to make the adjustments once we know which states might be affected in a negative way or not. But we're very positive in terms of the outcome that we think it will be, that a rational approach of what was really intended will be the final decision by the highest court.
All right.